Hello and welcome back. This is Amir Lahijy live from Los Angeles. Today, let's bring my whiskey. No, I'm not. I'm just kidding. Today we are going to talk about alcohol, and see what's going to happen when we drink alcohol in our brain and the whole body. So let's see who is here. Hello and welcome, Dr. Mitra Khorramshadi, psychiatrist and one of the best specialists. Hello.
Good evening. Hello. How are you?
I'm great. Thank you. How are you?
I'm very well. Thanks for asking.
Very good. Very good. So, Dr. Khorramshadi, I really appreciate for your time because we have lots of good feedback and everybody they loves your program. It's super knowledgeable and they like to see you more than 2-3 times a week. I know it's not possible. So let's talk about neurobiology and alcohol, or neurobiology of alcohol.
My pleasure. Sure. First of all, I have to know that everybody has experienced drinking alcohol. And I want to talk about two phrases that we usually use it.
Mm-hmm.
One is the alcohol use disorder. The other one is the alcohol abuse. And what is the difference between these two?
Mm-hmm.
Alcohol use disorder is the socializing when we're drinking alcohol and when we are celebrating with the alcohol. So means that you are drinking alcohol and we call it as a alcohol use disorder. But alcohol abuse means that we're drinking too much alcohol that affected our, psychosocial, situation of our life. When you are drinking and driving, you get the DUI. When you are drinking and, continuing your behavior, going to the work, sometimes you made a trouble for yourself and the others as a co-workers in the system. So sometimes
Or
you
you're
are drinking too
drinking.
much and
Yeah, go ahead. Sorry. Go ahead.
that's all right. You are drinking and you do have the problem with your friends, your spouse, your fiance, anyone as a significance others in your life. So sometimes we do have a difficulty in our interpretation to relationship with the other people when we are drinking the alcohol. So we do have two different entities. One is the drinking alcohol as a social habit, and the other one is the drinking alcohol as a habit that really affected our daily life. So I should tell you that drinking the alcohol and tendency to drink the alcohol does have the genetic component. So a majority of the people have low tolerance to absorb or metabolize the alcohol based on the genetic effect or gender effect. And the other people does have a little bit more tendency to get involved with the drinking alcohol as a addiction. So it's better to understand that what's going on when we are drinking the alcohol. Alcohol does have the positive enforcement and negative enforcement. For our brain system. And when we are talking about the positive reinforcement, means that when we are doing something good to gain something, it's a positive reinforcement. So, for example, that I'm drinking alcohol. I feel that I feel much better. I feel enlightened. I feel high. So I'm drinking more and more. This is the positive reinforcement of the alcohol. But negative reinforcement of the alcohol means that I'm doing something or I'm obtaining something because I want to delete the negative effect. A very simple example is that when you do have a very nagging spouse and you want to turn him or her off, not talking the way to you, you are doing a favor, putting the trash outside or do the dishes, because you are trying to off that person, negative effect of that person. This is the negative reinforcement. And we do have the same effect when we are drinking the alcohol. It means that when you are anxious, when you are depressed, when you do have the irritability, when your mood is not okay, you are drinking the alcohol. Why? Because you want to get rid of all this, the negative effect. You want to have a neutral effect. That's why you are, drinking the alcohol. And these positive reinforcement and negative reinforcement always make a vicious cycle. And getting out of this vicious cycle is not very easy. If, among other type of the addiction that we know, alcohol is one of them that it's very difficult to get rid of it. But what's going on with the brain? What neurotransmitter are involved with the alcohol? The most important neurotransmitter is the dopamine and GABA. GABA is a inhibitory neurotransmitter. Means that when GABA is involved, you do have the disinhibition behavior. You are laughing, joking, dancing, and any type of the behavior that you usually do not present it in the society in front of your colleagues and friends, you are exhibited. Means that you do have the disinhibition. But dopamine is another neurotransmitter. We do have two different locations for the releasing of the dopamine. One is the substantia nigra in the brain that associated with the motor activity, and we do have the dopamine in, Parkinson's disease. And another part of the dopamine is the VTA. We call it as a ventrotegmental area, which is associated with the emotion and the feeling and our achievement and this type of feeling. So in alcohol use or alcohol addiction, dopamine has been involved. So we do have neurotransmitters, and we do have the hormone release when we are drinking the alcohol majority of the time.
Okay, and now let's talk about the other effects of alcohol in our whole body.
Absolutely. If I started from the head to toe, there is a list. If you are drinking alcohol too much, first you are starting, affecting your cognition, your memory, your mood, your level of the consciousness.
Right.
Very simple that, majority of the time when we're drinking the alcohol, our state of mind is not as sharp as, before when we're drinking, not drinking the alcohol. And then, let's go down a little bit. We do have the oral cancer. We do have the esophageal cancer when we're going a little bit down. And then, a little bit down, then we will see that, GI, which is the gastrointestinal area, your stomach has been affected with the, alcohol. You do have the pancreatitis, acute pancreatitis, chronic pancreatitis, all of them, associated with the use of the alcohol. And then we go a little bit down and down, and we get a lot of cancers associated with the urogenital area, colon, intestinal area. So you name it, alcohol cause effect in many aspects. And, it's not just, somatic or physical effect of the alcohol. We do have a lot of, psychosocial and emotional effect when we are drinking the alcohol. And I have to tell you that majority of the personality disorders, they do have comorbidity with the alcohol. It means that you do have the anxious people as the anxiety, you have the alcohol substance abuse. You do have the bipolar people, always there is alcohol substance abuse. You do have personality disorders, and you do have the alcohol substance abuse. So there is a bunch of stuff that associated with the alcohol. So alcohol is very, very important regarding to have a consideration, especially for the young population. Majority of the people are, under 30, 35. And believe it or not, we do have a lot of, addict people that we should know how to screen them and how to help them.
So, and now let's talk about alcohol intoxication symptoms and treatment.
Absolutely. I have to tell you that there is a range and the limit that, when we pass that limit, we will show the level of the intoxication. I mean, when we are drinking, there's two different scale, but I'm trying to make it the easiest one for you guys regarding that. More than 0.08 is kind of overdose with the alcohol, and we call it as a toxic. It means that if you get arrested with the police officer, they will do the DUI for you, especially. Yeah, you're gonna get the tickets, absolutely. But if you go a little bit, higher and higher, what's gonna happen if you pass the, to 0.025, which we call it as a 250, and then sometimes we get to the 300, 400, which is the very, very high dose of the intoxication. The people with alcohol intoxication came to the emergency room usually with tremor. They are shaking, they are shivering. Wow. And they do have a lot of vital sign instability. The heart rate goes up, the blood pressure goes up. Sometimes we do have the cloudy state of the mind. Sometimes we do have aggression and agitation. So a lot of patient in the ER coming with the alcohol intoxication usually manifested as a behavior problem in the society. They came with the disinhibition, over disinhibition, or making problem with the public in the area. But we have to know that the best strategy for this group of the people is that to decrease the possibility and prevalence of the seizure, because the alcoholic people in intoxication, they are prone to have the seizure, and we have to give them, we call it as a banana bag, which is the yellow bag. We put them a thiamine, which is the vitamin, and then we gave them IV fluid, and we gave them glucose, and also we will give them some kind of benzodiazepine to decrease the threshold of the seizure.
Okay. We have a question from one of our viewers about pregnancy. So alcohol and pregnancy. Let's talk about that.
Very, very,
it's important, right? It's very
significant point. Yes, it's very important, especially for the teenage people, that they are having the different social habits. They are getting engaged with a different type of the relationship. And as we were talking many sessions ago, the mesolimbic area is in the charge when we are a teenager, when we are at the level of the age of 16, 17, before 23, 24. Mesolimbic area is the one that is in the charge, and prefrontal cortex is not in charge of anything. So they get involved in the sex activity, and they get involved with the drinking. It's not just the drinking. There's a lot of substances else, but let's focus on the drinking alcohol. And majority of the time they don't follow up their last menstruation period. They don't know that are they going to get pregnant or no. So just imagine that one a teenage girl get involved with the unprotected sex, and then drinking alcohol, and the fetus is developing after that. Usually they are not following to find out if they are pregnant or they are not. We do have in medicine, we do have alcohol. Means that not at all. We are not recommended any amount of the alcohol consuming by any the number.
Sorry, your audio is sorry. Your audio is break. I couldn't understand. What did you say? Say one more time your last sentence.
We were. I was trying to tell you that we do have the zero tolerance for the alcohol usage. So we are not recommending any type of the alcohol using during the pregnancy. And when we have a young lady drinking the alcohol, especially for the first 8 weeks of the pregnancy, we should worry about a lot of things. We should be worried about the cognitive deficit. We should worry about the cardiac problem of facial area.
Wow.
anomalies.
Wow. So, and it directly affected to the brain of that baby. So, and
Absolutely.
now let's back to the our brain when we use, and we're drinking alcohol. Some people they getting anxious. Some people they getting angry. Some people they bring up some story and starting argue some old stories. How's working? What's the brain function in these situations?
When we are drinking the alcohol, our cognition on the prefrontal cortex is not. So basically, we are just following up of the impulses on the mesolimbic area. So we understand that disinhibition behavior and verbal action of us is totally separated when we are drinking the alcohol. We do have long-term effect of the alcohol, which is and Wernicke aphasia. These cause the
Sorry,
speech problems.
it was a breakup again. You said we have a long term effects from there. Okay, and then
we do have the long-term effect of the alcohol on language area. We do have the two different type of the language area in our brain system. One is the Broca, the other one is the Wernicke. In a chronic manner, I mean, not just for 1 time, 10 times using of the alcohol. It's not going to happen. They get affected by the alcohol. Confederates. Sometimes they cannot remember what's going on. So they do have the retrograde amnesia. Amnesia means that you cannot remember. And when they are coming to the ER, sometimes they have the retrograde amnesia. They never ever forget what's going on. So different type of reaction you will see in the alcohol intoxicated people. And
okay, wow! Thank you so much for all informations. It was very good. Thank you so much. I hope you have a beautiful weekend and see you next time. Thank you.
My pleasure.
It's a pleasure. Thank you. So and stay tuned because we are going with the after a short break we have some musics, and also tell your friends if they didn't download the app. Remember, download our app for free and subscribe. It's very important to do a subscribe. Otherwise, when we decide to put some prices for monthly or per year, if you subscribe now, you can watch all of our programs for free forever. Okay, thank you, and stay tuned and stay in touch. Don't go anywhere.